In this video, you will learn the procedural steps for performing a change of suprapubic catheter, including the equipment required. This is an NHS Highland practice development skills video. This video has been made to be utilised in conjunction with the practice development skills training courses and can be used as a reusable learning unit to refresh your knowledge and skills. Course attendance and competency assessment must be completed before utilising the skill, and staff should make themselves familiar with the relevant NHS Highland skills policy, which can be found in the policies library on the NHS intranet site. Before approaching the patient, perform hand hygiene. Introduce yourself to the patient and explain the procedure, including risks and benefits. Gain verbal consent and check allergy status. Identify and check the following: the patient's clinical need for catheterisation, the size of catheter for clinical need, when the catheter was inserted, and how much water is in the balloon. Equipment required: sterile catheterisation pack, sterile saline 0.9% for cleaning, sterile lubrication gel, 10 ml of water for injection and syringe if no pre-filled syringe is included with your catheter, sterile syringe 10 ml for deflating balloon, an appropriately sized sterile catheter, a sterile drainage system, securement device, and 1 pair of sterile gloves. Perform hand hygiene. Clean the trolley using a neutral detergent wipe and then wipe down with 70% alcohol impregnated wipes. Place all the equipment required on the bottom shelf of the trolley and take the trolley to the patient. Ensure patient privacy. Check patient's identity and allergy status immediately prior to the procedure. Ensure the patient is in an appropriate position and dignity is maintained if removal of any clothing obstructing access is required. Perform hand hygiene. Put on a plastic apron and disposable gloves and empty the drainage bag. Remove disposable gloves and plastic apron. Perform hand hygiene and reapply plastic apron. Slide the catheterisation pack onto the top shelf of the trolley. Then, using an aseptic technique, open the pack and other equipment required and pour the 0.9% sodium chloride into the galley pot, using an assistant if possible. Gel hands and apply disposable gloves. Deflate the balloon and remove previous catheter. Take note of the angle at which the catheter is removed and also the length of the catheter that has been removed. Remove gloves and perform hand hygiene. Put on sterile gloves. Place the sterile sheet below the suprapubic area. Please note, it's not been possible for the sterile sheet to remain in place while making this video due to the shape of the model used. When carrying out the procedure in clinical practice, ensure the sterile sheet remains in place throughout the rest of the procedure. Clean around the suprapubic area using sterile saline. Apply sterile lubricating gel to the catheter. Insert the catheter at the same angle into the abdominal tract within 30 to 40 minutes. Advance the catheter slightly further than the length of the catheter that was removed. You may need to use a corkscrew action. When inserting the catheter, avoid touching the patient's skin with your gloved hand to prevent contamination of your sterile glove. Inflate the balloon slowly, ensuring the patient isn't feeling any discomfort during inflation. Withdraw the catheter slightly and connect to the new sterile drainage system. Observe for urine, which may not be immediate and may be a little blood-stained. Secure the catheter to the abdomen. Dispose of any equipment as per NHS Highland policy and perform hand hygiene. Observe the patient for any adverse reactions and document and manage any complications. Complete the insertion sticker and invasive device bundle. Please ensure that appropriate PPE is worn when carrying out all clinical skills, including aprons. Aprons have not been worn during the making of these skills videos to reduce noise interference.